Now, last time, because of lot of, I was trying to tell you something about the rubric. So I could not complete that because I had a lot of questions on the WhatsApp. So I just prepare a topic so that if there are no questions, then I can tell you something about the rubric. This is what I have thought of. So if you have something else, you can always tell me so that I can prescribe or then answer those type of questions. Now I'll take a simple rubric. There's a rubric called as, suppose, hysteria. Now, if you understand the rubric hysteria, what happens if a person tells that he has taken the rubric hysterical? Now, it is not always that hysteria means out of control, the patient pagal ho gaya hai, patient out cheech kar raha hai, that is hysteria. You can also use hysteria, patient बहुत बार आके बोलते हैं, sometimes the patient comes and tells us, sir, this is a patient, my mother is like, if I tell her something, she'll do that thing out of control. If I tell her to walk, she'll keep on walking. And if I tell her don't walk so much, and she'll stop walking. So the reaction of the patient is hysterical. There is no balance. Remember my wordings, there is no balance. Then you can take the rubric hysteria. For example, if somebody, has expired in your house, you keep on crying out of control, you're never coming out of it. And one person, he does not do anything and he's out of it. So if there is loss of control, if there is no balance between an event, then you can take the rubric hysteria. Simple, I had a case of coccynoderma, pain in the coccyx bone. And when the pain started, the patient, he used to behave such weird, he stopped working. He said, I cannot work, I'll just go and sleep. And when the pain was better, he started working so much that the pain started again, and he again had the same symptoms. If you open the rubric hysteria, injury of coccyx from, the only remedy is hypericum. Hello, everyone? Are you with me? The only remedy is hypericum. Welcome, Dr. Joshi, Dr. Pandav, Dr. Nitin. So I'll take one question first before I go to the rubric part. Person's chest make a sound when he sleeps. It is like sound produced when a saw cuts the wound. He also has chronic bronchitis. Please suggest medicines. See, my dear friend, whenever you have this type of complaints, like you can always say rattling in the chest. Now, if you see rattling in the chest, first, the remedy that everybody will start prescribing is that one, Entim-Tat, rattling, deathly rattle. So it is not always Entim-Tat for rattling. I'm very happy that you asked this type of questions. Rattling respiration, and there are different things. Coarse rattling, matlab coarse means it feels as if air is passing through the water. Coarse rattling. There are other drugs. Rattling on expiration, rattling on inspiration. So basic remedies for rattling that you should know. Of course, first is Entim-Tat, but I have seen results with remedies like Dalkamara, Pulsatilla, Ipecac, Hippozynium, Causticum, where there is lot of rattling. For example, think Entim-Tat when there is rattling and there is no expectoration. A very, very simple explanation when to give Entim-Tat when there is rattling and there is no expectoration. For example, when the patient says, whenever there is rattling, when I walk, I sit, I am happy. If I lie down, the rattling aggravates. You must think about caustic. Rattling in old people, we have remedies ammonium carb, but Hippozynium is a very important remedy which I have used in my practice. Coarse rattling, then you can think of a very, very interesting remedy, Entim-Tat and Kali Sulf. Okay, this is about rattling. Welcome, Dr. Vishaka, Dr. Sai Rekha. Though anxiety is there for the whole day, but aggravation more at night, sleep gets open after a few hours. unable to sleep again, having a lot of fear. This is very simple, Dr. Nitin. You have answered your own questions. Now you have seen a very, very interesting thing, anxiety. Now, anxiety is whole day, especially more in the night. And we definitely have the rubric anxiety more in the night. One thing. Second, you have said the patient cannot sleep. So, anxiety more in the bed also you can take. And third, so much so that it drives the patient out of bed. Very, very simple remedy. There are 3-4 remedies you can write down. First is arsenic album, second is rustox, and third is graphitis. Okay? Let us go further. Negative thinking and sadness is also there, unable to stay calm. Please help. Yes. That's what I have told you. Anxiety in the night, which the patient drives him out of the bed. Whenever you are using a rubric, don't think very hi-fi. Take simple things. Rustox, arsenic, and graphitis. One of the 3 remedies. Okay. I hope you got the answer, Dr. Indradev. See, negative thinking is a state. Everybody passes through that state of negative thinking. How does the patient react with the negative thing? That is very important, my dear friend. वो बहुत important है. जैसे मैंने आपको बताया था एंग्जाइटी के बारे में. गुड आफ्टरनून डॉक्टर सिंह. मैंने आपको बताया था एंग्जाइटी. अब इफ यू आर प्रिस्क्राइबिंग ओनली ऑन एंग्जाइटी एंड द पेशेंट ड्राइव्स हिम आउट ऑफ द बेड, you may sometimes fail. You must know why there is anxiety. What has caused anxiety? That is very important. Welcome, Dr. Barbal. Anxiety, for example, I had told you yesterday, last time only. Anxiety, the patient wakes up in the morning and says, "Oh God, now what to do? I have to do business. I have to do here. I have to do. Go on." The anxiety starts in the morning. We have different remedies. The cause of anxiety, if you understand, then your answer would be automatically given. If you only prescribe on modalities of anxiety, morning, evening, night, you might get a lot of remedies but not the perfect remedy. Okay? For example, patient आके बोलता है डॉक्टर साहब गुस्से में when I'm anxious मेरा खून खौल जाता है. When I'm anxious, the blood starts boiling. Anybody? Which remedy you must think about? Anybody? ये पेशेंट के लैंग्वेज है हिंदी में, डॉक्टर बारबल. हिंदी. द पेशेंट सेज मेरा खून खौल उठता है, इतना घबराहट होती है मेरे को. द पेशेंट सेज माय ब्लड स्टार्ट्स बॉइलिंग बिकॉज ऑफ एंजाइटी. देन यू मस्ट थिंक ओनली ऑफ वन रेमेडी. एंड व्हाट इज दैट? एनीबडी? द रेमेडी इज इलैप्स. I had just prescribed about 3 months back a case of relapse. I cured it with this symptom. One more symptom of relapse. Because of this, the patient has biting of fingers at night. That is also relapse. So let us go forward, sir. Anxiety is there, but how will I cope with my new job? Okay. Having loss of confidence that I won't be able to face the situation. Very, very well. So this anxiety, Dr. Nitin, everybody has it. Whenever I'm going for a seminar or a webinar, I also have an anxiety whether I'll be able to do well, whether I'll be able to make them understand what I want to say. That is very common anxiety. You can't give medicine for that because this is a part of life. Anxiety, fear is a part of life which everybody has it. He has to grow over it. If the patient is not able to grow over the anxiety, then you have to see what is the SORA. Very much pampered child, not allowed to go outside, have not seen the world. They have anxiety because the bases are very weak. The basic knowledge is very weak. Then you have to go back to SORA and answer you will get from there. Anxiety about disease where alone. You have the rubric anxiety disease of. Okay. Sir, thank you. One of my friend having HbA1c 8 came down to 5.5 with your only treatment within 6 months. Yeah, Dr. Joshi is saying thank you so much. And I'm also very happy, when I'm treating cases of diabetes, blood pressure, hypothyroid. These are very challenging metabolic cases. Of course, it's in a very nascent stage. I'm getting good results in case of diabetes, but I'm working on it more. But if there is a result, I'm very happy. And maybe in future we'll have some homeopathy treatment where the patient only takes homeopathy and not any allopathy medicine. So I'm working on that. Thank you so much. I think Dr. Barbal will also understand. I had cases, I had shown them cases of hypothyroid only on homeopathy treatment without taking any allopathy treatment. The patient was better. Okay. Thank you, Dr. Joshi, for sharing experience. Anxiety about disease well alone. Patients opt for chemotherapy. Should homeopathy be used to treat the side effects? Why not? And this is very important, because chemotherapy, there are a lot of side effects. First of all, if I had a case where the patient had cancer of the tongue, is on chemotherapy, lot of ulcerations in the mouth and the tongue, cannot swallow, lot of dryness of mouth, lot of anxiety, depression, lot of blackness of skin around the mouth, and he's under my treatment. He's much better. He is doing chemotherapy and he's taken the medicine and he's much better now. He can eat also properly. So you must give. Sir, I can't stay alone like the company of selected only. Arsenic should be taken in 30 daily. No. Dr. Narula, please take arsenic LM potency. Start from 0/7. Anxiety about disease whenever alone. Where it is gone. Yeah. Better mentally occupied. Dr. Yasin, go to the repertory, take the rubric, thinking of complaints ameliorate. The remedy is there. Also, female patient having irregular menses and hysterectomy is now having regular pains, less menses regular. Thank you, Dr. Joshi. Yeah, he's a doctor only. And thank you for sharing, and thank you for, boosting my confidence also, because every time you get results, you always feel that you know something better of the remedy which you have prescribed. Actually, that's what I'm working on now. There are a lot of remedies which I have seen in my practice, clinical symptoms which are not there in the books, which I have developed in my practice. So if I get a chance to teach Mathemedica for a seminar or webinar for students, I would like to share my understanding of Mathemedica, my symptoms, what I have seen clinically in my practice, so that it helps the practitioner to grow. Because everything is written in the books, बट समटाइम्स इन अ प्रैक्टिस हमारे प्रैक्टिस में हमको ऐसे ऐसे सिम्टम मिलते हैं जो कि लिखे नहीं रहते हैं, बट फिर भी हम उसको वी ट्राई टू एडजस्ट दैट सिम्टम एंड वी ट्राई टू go beyond and see why is the patient telling this way. So this is a different approach of mathematics which I have developed in my 30 years of practice, where I use my clinical knowledge in understanding the patient's symptoms and turning into either a rubric form or a symptom in the Mathematica. Thank you so much. Sir, I mean, I had to say the company of people. If you want to take arsenic in repeated doses for anxiety case, you can repeat, Dr. Nitin. You take arsenic alb 0/7, 2 times a day, then 8, depending on the result, 1 time a day, then once in 2 days. Depending on that, you can automatically, prescribe the remedy if you think arsenic is right. Okay. So this is where, I had a case, I had a case, whenever the patient told me that whenever I have my first meal in the morning, it is 6 o'clock, it is 8 o'clock, it is 11 o'clock, 12 o'clock, I start getting panicky. Now I have taken my meal and now I have to go for work. Very whimsical and very stupid type of symptom. I prescribed few remedies, it did not work. Then as I was speaking, I was telling to my assistant, what a whimsical type of patient, whenever he takes the first meal in the morning, the anxiety starts. Whimsical. I took a rubric, anxiety after breakfast. And whimsical, if you see in Kent Mathematica, the remedy is Kali Carb. If you open your repertory, anxiety after breakfast, the remedy is Kali Carb. So this is how Mathematica, understanding of the patient and then prescribing, helps you in your practice. Okay. Please explain the rubric better when occupied mentally. See, whenever the patient says that I have tendency to go to bathroom every time, but when I sit in my clinic after 3-4 hours, I have no problem. But when I come out of the clinic, that anxiety increases. This is called as occupied mentally ameliorates, or the patient is better when he is occupied mentally. Are you with me, everyone? Just give me some thumbs up, so I know that everybody is understanding. Okay. Dr. Yasin, I hope you got that. So that's what I'm telling you, rubric. Now, sometimes the patient comes to you. Hello, can I go forward? Sometimes the patient comes. You understood Kalikar? Why did I give Kalikar? Everybody, at least tell yes or no, so that I know that you know you understanding what I want to tell. Remedies. See, Dr. Yasin, there are so many remedies. Whatever I can think of, sepia, naxomica, natrum carb, cuprum med, ignitia. That's all I can remember of what I can remember now. Sir, does the symptom also matter when the patient likes the company of people or not? In my case, I like the company of selected people. Yes, definitely. Very well. This is very, very important. Okay, the patient is very selective. Okay, now there can be a lot of reasons for that. If you feel that if you're a very sentimental patient and if you are a company of a lot of people, if somebody hurts your parser taunt or jokes or does sarcasm, you don't like that. So person who is very much hurt or very much sensitive, he wants only company of selected people who do not hurt. This is sentimental approach of the patient. So it is definitely important that selective of a special group of people is very, very important. Or sometimes the patient is covered. The patient only wants the company of those people where he can command, like a podium. Or the patient feels that his knowledge is not so good. So he wants only people who are less knowledgeable so that he can speak and nobody answers question. Okay? So there are a lot of permutation combination, डॉक्टर साहब. So आपको इसके लिए आपको थोड़ा ध्यान रखना पड़ेगा. सिलेक्टिव भी बहुत इंपॉर्टेंट है. चलो आगे बढ़ते हैं. I am talking both in Hindi and English because there is a foreign crowd, so that they have a problem of understanding. Okay. Now as you go further, ये समझा rubric anxiety का understanding. Kalikar, very interesting case. I cured with that with Kalikar. Now there was one lady, she was an entrepreneur and she was working day and night. And said, I am so confident that I will never be able to do any problem in my वर्क. बट वेन एवर आई कम होम, मैं जब भी घर पे आती हूँ मेरे को खाना बनाना का टेंशन रहता है, झाड़ू मारने का टेंशन रहता है, मदर इन लॉ का टेंशन रहता है, हस्बैंड का टेंशन रहता है. मेरे को बड़ा मजा आता है बाहर काम करने में. आई डोंट लाइक हाउ बिकॉज आई फील वेरी एंशियस व्हेन आई एम होम. Yes, arsenic is a very selective personality, aristocratic, yeah. Patient can study, always want someone around and constantly wishes while studying. Yeah, patient can study alone, always wants someone around and constantly whistles while studying. I had 3-4 cases, doctor sir. When the patient was appearing for NEET exam, JW exam, the patient always liked to be very silent, very silent. But he wants everybody outside in the room so that he knows that somebody is there. There are remedies for that. Aversion to company yet aggravates. Desires company yet aggravates. There's a rubric. You can go in the rubric and see that. Cannot. Yeah, so that was I'm asking, There is a rubric called as company desires. See, open the rubric. Company desires, but alone when aggravates. Lot of persons, students entering for JEE, NEET, lot of. I had cured that case. I had 2 cases recently which I cured, one with phosphorus and one with arsenic. Yeah. So let us go forward. So Dr. Nitin, I hope you understood that this is the importance of understanding, about rubrics. How to change, how to see the rubrics and how to apply that in your practice. There is one interesting rubric, The patient has aversion to company even if the company is very good, of very good people. Matlab, doctor sir, I don't like company of people who are very good also. Those are very pleasant. The only remedy in this rubric is Helleborus. Helleborus. Understood? And there are people who always want to stay alone. The rubric is aversion to company, fond of solitude. Fond of solitude. So कौन सी रेमेडी हो सकती है डॉक्टर साहब? एम्ब्राग्रेजिया. What is the main symptom of ambragresia? Cannot pass urine in front of others. Don't take that literal meaning. Nobody likes, passing stools and urine in front of everybody. If it is there, the rubric is shameless. But aversion to company, desire, fond of solitude, ambragresia, very important remedy. Or metallicum, very important remedy. Pulsatilla, very important remedy. And platinia, very, very important remedies. Understand the rubric. I had a case. The patient likes company. The patient craves for company. But when he is sick, he does not like anybody. Can anybody guess the remedy? The patient likes everybody around him. He likes company. But when the patient is sick, he wants to be alone. Which is that remedy? Anybody? Can you guess? Anybody? Anybody? Yes? Anybody? Can you understand the remedy? Why not? The patient likes company, but when he is sick, he wants to be alone. The very important remedy is antimptart. Don't always think about antimptart ke bhai kharkar ho rahi hai kya, kharkar ho rahi hai kya, neend aa rahi hai kya. An antimptart patient likes company, but when in disease, when he's sick, he likes solitude. That's a very, very important entry point of antimptart. This is the beauty of understanding rubrics. Are you with me? This is the importance of understanding rubrics. As you go further, there is a very interesting case where the patient has aversion to company and he starts weeping. The patient has aversion to company and he starts weeping. Which is the remedy? I had a case where the patient says that, Doctor Sahab, we don't understand. We tell him to go and meet with the friends. He does not want to go there. And when he's alone, he's crying. Which remedy comes to your mind? Anybody? Which remedy comes to your mind? The only remedy, the symptom that you must take is aversion to company with weeping. Anybody? Remedy? Can you get the remedy? Can you get the remedy? Sometimes I also have to ask questions, no? Yes, the only remedy you must think about is Rustox. This is the importance of knowing the Mater Medica in your clinic. Otherwise, Rustox, we think restlessness and bony pains, it is there. But if you get this rubric of symptoms of Rustox, you can never fail with this. This is the importance of understanding the rubrics and converting the patient's language into rubric form. Now I'll tell you other thing. The patient does not like people, or he may not like, but when he has headache, he wants everybody to be with him. Which remedy? I had an interesting case of migraine. I had a very interesting case of migraine where the patient used to come and tell me that, Doctor, my child, whenever he has headache, he will call me, he will call his father, he will call his sister and say, come and sit with me. Otherwise, he never calls anybody. So we took a lot of rubrics, desires company, wants sympathy, nothing worked. But this rubric, company desires during headache, the symptom was in front of me. In headache he does that, but I was taking the general rubric. The remedy was Minianthus. Hello, are you with me? Anybody? Everybody, are you with me? अरे भैया कोई yes तो no तो बोलो. Yes or no? Everyone. Yes or no? Sorry for no. Yes or no? You getting it? So during headache, the patient requires company. The only remedy is Menyanthus, Menyanthes. So can we go forward? Can we go forward? Now I will tell you one more rubric. I will tell you one more rubric. The child says that whenever I want to sleep, I want my parents. I want to sleep with my parents. I want to sleep with my parents. Again, in this case, I had taken the rubric same. कंपनी डिजायर्स, उसको कंपनी बहुत पसंद है, माँ बाप पसंद है, डर लगती सोने में, नथिंग वर्कड. बट देन आई कन्वर्टेड द, वो लड़के का जो सेइंग है, आई कन्वर्टेड दैट एंड आई गॉट द रुब्रिक कंपनी डिजायर्स फॉर स्लीप विथ पेरेंट्स. And in that, the only remedy is saccharum officinalis, that is sugar cane sugar, and we cured that case. Hello, are you with me, everybody? Yes or no? Yes or no, anybody? अरे आप लोग yes no बोलेंगे तो मैं कैसे आगे जाऊंगा? Yes or no? You got the remedy saccharum officinalis, you got the remedy what we call Menyanthus, you got the remedy Kalikaram, you got the remedy. These are very, very important things to understand in a practice, converting our symptoms of the patient into rubric form. Now one more rubric which I have used in my practice, which I have got very good results. Some patients come and tell you that whenever we are whenever I am talking or whenever I am in a group, I feel very happy. That life में कुछ तो हो रहा है, बाकी लाइफ में मैं करके मैं लाइफ में बोर हो रहा हूँ. आई गेट बोर्ड. सबके साथ में रहो, बात करो तो मुझे बहुत अच्छा लगता है. विच रूब्रिक और विच सिम्टम कैन यू टेक फॉर प्रिस्क्रिप्शन? एनीबडी? कभी कभी तो मुझे पूछने का मौका दो. एनीबडी, विच रूब्रिक यू कैन टेक? और जितना मैं बाहर, I don't like to stay at home. I want to go out and talk to people. I am very happy with that. This is a very, very important symptom, and I have given this with remedy Hemamalis, which we never think of in a routine practice, because Hemamalis we only think about for piles, bleeding piles. This is called as desires for conversation. मतलब अपना थिंकिंग, अपनी ख्याल से बातें करना. Are you with me, anybody? Are you with me? समझ में आ रहा है कि नहीं? लैंग्वेज हिंदी में समझ में आ रहा है कि इंग्लिश क्या बोल, हिंदी इंग्लिश क्या? आपके यहाँ से कुछ रिजल्ट्स नहीं आ रहे, कुछ हाई वाई, मतलब आर यू अंडरस्टैंडिंग इट? Likes conversation. Of course, there are a lot of remedies, but I have given and worked with Hemamalis. It has given me a lot of good results. There is one more remedy which I give for this conversation ameliorates, and that is Chinopodium. Chinopodium. I think Dr. Barbal would understand the meaning of Chinopodium. Very, very important remedy. Okay? I hope you are getting the importance of rubric, my dear friends. Don't get stuck only on anxiety, because if you're stuck in anxiety, every patient have that, Anxiety for household matter, which I told you about, that entrepreneurship. She's very anxious when she's working at home, but she's very happy and very confident when she's working in her business. The remedy which I prescribed to that lady was Naxomica. And if you see, Naxomica is a businessman, works, but in household works, the Naxomic has lot of anxiety. Hello, are you with me, everybody? आज there is सब बहुत ढीले लग रहे हैं, आज कुछ रिजल्ट नहीं आ रहा है. Okay, so I have only 1 minute to share with you, otherwise half an hour would be up. Let us go forward. One more. There is a case where the patient had a simple trauma in life, but the patient is not able to get over that trauma. It has been 1 year, 2 years, 3 years. The patient does not get over the trauma. The very important rubric for this is I prescribe the patient Vatramal. Anxiety inconsolable. So much anxious. That event of trauma he has never forgotten. There are 3-4 remedies. First is Vatramal, second is Naxomic, and third is China, my dear friends. So this is just, I wanted to make you understand the importance of understanding of rubrics. It's already half an hour up. So thank you everybody thank you for joining, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you until next Saturday. Goodbye.